Hello and welcome to this edition of i3 Health's Additional Advances. Today I'm joined by Dr. Benjamin Cohen, who recently presented the activity Remission, Individualized Evidence-Based Strategies to Optimize Outcomes in Ulcerative Colitis. Thank you so much, Dr. Cohen, for joining us today. Would you please introduce yourself and what you do?
Sure. Hi, I'm Dr. Benjamin Cohen. I'm a gastroenterologist specializing in treatment of inflammatory bowel diseases, including ulcerative colitis and Crohn's disease, at the Cleveland Clinic, where I'm vice chair for gastroenterology, hepatology, and nutrition, and the co-section head for inflammatory bowel disease.
Terrific. So to begin, I would like to ask you, how have you seen the treatment of ulcerative colitis evolve over time, and has there been any recent updates in the past year or so since presenting this activity?
Over my career, the biggest change I've seen in management of ulcerative colitis is the heightened importance of treating disease early with our most effective therapies. The paradigm used to be that we started with our less effective non-immunosuppressive medications and only gradually stepped up to treatment with our more effective advanced therapies. However, research over the last 15 to 20 years has shown us that ulcerative colitis is a progressive disease, and the earlier we control inflammation, the better long-term outcomes will be. Early disease is a window of opportunity to control disease and prevent long-term complications, including the need for surgery. And updates in the last year include updates to both the ACG and AGA guidelines on management of moderate to severe ulcerative colitis, which provide some guidance on positioning of our advanced therapies in both treatment-naive patients and those in whom advanced therapies may have already been used.
Why is it important, especially in treating ulcerative colitis, to identify at-risk patients as quickly as possible?
Early disease is a window of opportunity to control inflammation before progression of disease, including extension to pancolitis, severe flare requiring hospitalization, and development of blood clots, among other complications. So, identifying patients with red flag features for a severe disease course can allow us to get them started on our most effective therapies right off the bat.
And how can clinicians effectively stay on top of evolving treatment options and strategies for UC?
Management of UC is a rapidly evolving landscape, and it's important to keep up to date with the available treatment options and positioning recommendations as we continue to learn more. I do this but by following the living AGA guidelines, attending national meetings where there are updates, and participating in CME activities such as the escape room to keep self-education fun.
Can you describe the impact shared decision making has had on your practice and relationship with your patients, and why you recommend this approach?
In the early days of advanced therapy for ulcerative colitis, we didn't have many options, and the conversation with patients centered around safety concerns of immune suppression. And while safety is still important to patients, there's increased recognition that using advanced therapies is important for disease control. However, now we have many options, and the discussions center more around which treatment to choose among the many options. So, given these choices, shared decision making can be important to help decide which one will fit the patient's disease and life. We have options with different safety profiles, modes of administration, as well as effectiveness in different scenarios, such as severe disease or management of extraintestinal manifestations of colitis. So, setting goals for treatment with the patient is critically important in helping to select the right therapy for them.
And as we conclude, are there any messages to those listening that you would like to share regarding the importance of educational opportunities such as these and what you're looking forward to in the future of UC treatment?
Staying on top of the rapidly evolving treatment landscape for UC is important for our patients. We continue to learn more about how to use and position advanced therapies for ulcerative colitis, and I expect this will continue to evolve in the coming years. We'll have new mechanisms of action available, and we'll likely learn more about how to potentially combine advanced therapies. So, utilizing activities such as the escape room can keep this self-education fun and also help us better to serve our patients.
Terrific. Thank you so much, Dr. Cohen. We appreciate it.
No problem.